Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I'm going to discuss with you all about 7th of May 2022 OET exam, in which we are going to discuss about OET writing as well as OET speaking. Okay, so let's move on to the topic. So what is the letter they have asked? They have asked the transfer letter. It's a very simple transfer letter and we are just writing this letter to the nursing home manager for the ongoing care and management of the patient. Okay. So what is the patient name? Patient name is Jeremy, but I'm not sure with the second name because my student did not give me the second name of the person. And the patient age is 76 years old. And the patient suffers with Parkinson disease since 2008. And he is on the medication for that, which includes levodopa and carbidopa. And also he is a hypertensive patient. He is on amlodipine and also low salt diet. But the diet management is really unsuccessful to the patient. And coming to the social background of the patient. So social background, patient is a divorcee and he is a retired teacher. He lives alone and though he has a son and daughter, there is no contact with them, and he has a sister who visits him occasionally. And also he is finding difficulty to cope with the life, and he is having poor compliance with the medications as well as the dietary regimen. Alright, and now patient came to the clinic for the follow-up. So during the follow-up, he is just explaining his complaints to the nurse, and the nurse is examining the patient, and she's just got the patient is suffering with depression, and also she is writing this letter to a nursing home manager for an ongoing purpose. Okay, so what is the discharge advice that she is writing? So in the discharge advice, actually she is writing the patient needs to be monitored for the medication complaints as well as the side effects and the dietary regimen, and also they have to accompany with the patient when the patient is coming for the follow-up visits, and also they have to continue with the physiotherapy. These are the discharge plans. And what is the present complaints? Why the patient came to the clinic, and with what complaints he came to the clinic, and what is our examination proved to us, and what is the diagnosis of the patient. Okay, so actually patient came to our clinic. What is the purpose? Which means the patient came to our clinic because of he came to the clinic for the follow-up appointment. So during that time, he just explained to the nurse that what he is going through exactly. Actually, he is having low mood and upset as he no longer drives, and his concerns are loss of independency, social network, and also he suffers with difficulty in swallowing and to forget to taking the medicines. But he is good in activities of daily living. He is able to manage it. And on the examination, the nurse came to know that the patient has tremors, rigidity, and also poor memory. Thereby, the patient is assessed with depression. And the plan, now we are just transferring the patient to the nursing home for an ongoing care and management. Okay, so now how we are going to write this letter? So now we'll start from the introduction. So in the introduction, as usual, we needed three things. One is patient name, and another one is patient condition, and then third one is purpose. So purpose is a more weightage part in the introduction. So how we gonna make an introduction in this letter? So Mr. Jeremy. So here we can write even two way we can write. Mr. Jeremy, who has depression followed by Parkinson disease, he requires a full-term nursing care and management at your service. So this is one way of writing an introduction. The second way we can write, I'm writing to transfer Mr. Jeremy, who has depression followed by Parkinson disease. He requires an ongoing care and management at your service. So this is the two way we can write the introduction. Choice is ours. And please make sure when you're writing the Parkinson disease, because Parkinson is the name of the person, the disease condition derived from the name of the person. So thereby we must mention the Parkinson P should be capital and the disease T should be capital. It is very much important. We have to make sure with that. Now coming to the point of present medical history. So in which what happened exactly during the today's visit. That is the thing we are going to elaborate it. From the present medical compliance to until that what we have diagnosed and what assessment and what advice we have given to the patient. So Mr. Jeremy presented to our clinic on this day with the complaints of so and so complaints you are writing. On assessment, he was found to have tremors, poor memory, rigidity, swallowing difficulty. So these are other things, poor medication compliance. So thereby what we have done, and on assessment this one. So Thereby, he was assessed with the above mentioned condition, because we have mentioned already depression in the introduction. So, no need to again repeat the depression in the second paragraph. Thereby, we are using the word, is called it as the above mentioned or else the forementioned diagnosis. Like that, we can make it simple. And thereby, he needs an ongoing care in your nursing home. Now, coming to the point of social history. Social history is very important. Because of the social background only, he suffers with the depression, and nobody is there to take care of him, nobody is there to support him, nobody is there to mind him. So that is the main reason. So we have to elaborate very clearly. So how we can start? Socially, Mr. Jeremy is a divorcee, lives alone, and he is a retired teacher. Though he has a son and daughter, he has no contact with them, and he has a sister who visits him occasionally. He has Parkinson's since 2008, and he is on levodopa and carbidopa. Full stop. He has hypertension, and he is on amlodipine with a dietary modification. However, he is unsuccessful with his dietary regimen. That's it. Very simple. Now coming to the recommendation paragraph. So recommendation paragraph: in view of the above or upon transfer, it would be greatly appreciated if you could monitor his medication compliance, especially the side effects of the medications, in which if he suffers with insomnia, please inform to his GP for the further treatment and management. Then next, kindly encourage him to consume low salt and dairy products. And next thing is, please continue physiotherapy as he suffers with tremors and rigidity to improve his muscle strength. The last thing is we are just saying, more significantly, accompany with him whenever he comes for the follow-up. That's it. Then conclusion. Please contact me for further details. Then if there is a name of the nursing manager name is presented in the address, which means you are completing the letter with yours sincerely. If there is no name, you can complete the letter with yours faithfully. That's it. So this is very simple letter. It is an unknown case letter also, so you can make it in a very good way. I hope whomever have done with their exam, they have done in a good way in their writing. I hope so. Okay, so hope for the best result. And coming to the point of your speaking topic. So speaking topic also is a very simple topic and familiar topics also, because the first topic is like a baby who is having a clavicle fracture. So the mother is concerning about the baby's condition, recovery process and treatment opinions. So we are just giving the advice, because it is somewhat the green stick fracture topic. So it's the same concept, but the problem is like the baby is having the clavicle fracture. In another topic, it was a green stick fracture. Okay, and the second topic is like the baby is having intersuspension problem, and the baby is planned for the x-ray. The parents are very concerning about the baby, and they are worrying that they want to also accompany with the baby for an x-ray. So we are just explaining about what is the disadvantages that being accompanying with the baby for the x-ray, and we are explaining about the treatment option, because baby is on NG tube and IV line. So these are other things that we are explaining to the parents and make them to comfortable. And then third topic is like we are just explaining about the gallbladder surgery preoperative preparations, in which especially we are just explaining about the dietary modifications and what are the diets that patient has to follow up. So that is the third topic. And the fourth topic is like baby is having not a baby, it's a kind of a pneumococcal vaccination. So explaining about the pneumococcal vaccination is important, and benefits, side effects, and why we need to take about this, all those things we are just explaining about it. So these are the very simple topics. So usually when we are going for the speaking, we are getting usually one topic will be always a vaccination, another topic is kind of a health education, and another topic is kind of a preoperative or postoperative instructions, and one topic is kind of the IV lines, or changing the IV lines, are kind of a we are just explaining about the fracture. So this kind of one baby topic will be there, and preoperative topic will be there, vaccination topic will be there, and kind of a home visit topic will be there. So this time they did not ask the home visit topic. The appendectomy patient, actually what happened, which means the patient is having IV cannula which is not functioning normal. So we are just changing the cannula to the another hand. So thereby we are getting the concern, patient is getting panicking. So we are just explaining why we have to change the cannula and what is the importance of having the cannula. This all those things we are just explaining it. So it's overall the exam is so good, like in writing and speaking is so good, but my students have said about me that listening and reading somewhat is a bit difficult. So anyhow, hope for the best result, and this speaking topics and this writing explanations will be helpful for the students who is preparing for their upcoming exams. I hope so. And also whomever wants to join for our class, we have a mock batch and we have 40 days, 60 days and 30 days classes also is there, and our number given in this description. Whomever wants to join for the class, so you can join to our class fastly. Okay,